Hi, I'm Dr. Masha, naturopathic doctor and hyperbaric expert. In this video, you will learn about common nutrient deficiencies in polycystic ovarian syndrome. You will learn how to test for these deficiencies and how to correct these deficiencies. If you watch this video to the end, you will receive information which medications that are often prescribed for polycystic ovarian syndrome cause nutrient deficiencies. Polycystic ovarian syndrome is a reproductive and metabolic disorder, and it affects equally men and women. It was always thought to be a female-only condition, but now we know that it affects male offspring of women with PCOS as well. Main features of PCOS are insulin resistance, weight gain, anovulation, infertility, and excess production of androgens, male hormones, which results in acne, facial hair, and hair loss. Like any disease, PCOS is affected by nutrient status. If you have too little or too much of a nutrient, it can lead to health issues. Women with PCOS are known to be deficient in several nutrients, and when we correct these deficiencies, it helps to resolve PCOS symptoms. Vitamin and mineral deficiencies can be caused by several factors. First and foremost, it's inadequate intake or absorption. So you're either not getting enough of the vitamin or you're not absorbing this vitamin. Another factor is the increased requirement for the nutrient. Also, certain medications deplete nutrients. In PCOS, we have all three factors that are affecting the nutrient status. So, polycystic ovarian syndrome is associated with several nutrient deficiencies. Correcting these deficiencies can help manage and even reverse PCOS symptoms. Let's look at common nutrient deficiencies in PCOS. D-chiro-inositol and myo-inositol. Women with PCOS, there is a myo-inositol deficiency due to increased conversion of myo-inositol to D-chiro-inositol at the level of the ovary. Supplementing with D-chiro-inositol and myo-inositol in women with PCOS restores their menstrual cycles, fertility, it improves insulin sensitivity, and it also decreases facial hair and acne and helps with weight loss. High glucose levels increase inositol degradation, and urine inositol test is a marker for glucose intolerance. We can get myo-inositol in fruits, beans, grains, and nuts. The problem is that fruits and grains are carbohydrates, and usually women with inositol are not doing well with this kind of foods. So supplementing with myo-inositol is a better idea. Another nutrient women with PCOS are often deficient in is vitamin D. When we supplement with vitamin D, it helps to improve insulin sensitivity, it assists in weight loss, and it helps to decrease inflammation. Blood tests can measure vitamin D level, and we should only supplement when the levels of vitamin D are deficient. There are two ways to get sufficient vitamin D. First, and I think most important one, is spend time in sunlight. You can also supplement. Trace amounts of vitamin D are contained in fatty fish, egg yolks, mushrooms, and liver. Magnesium is another nutrient women with PCOS are often deficient in. Low levels of magnesium increase PCOS risk by 19 times. There is a link between low magnesium level and insulin resistance. Magnesium is also involved in vitamin D activation, so low magnesium can lead to low vitamin D status. Magnesium supplementation in women with PCOS has been shown to improve insulin resistance, decrease anxiety levels, reduce pain and inflammation, promote better sleep, and relieve PMS symptoms. This is how important magnesium is. There's no test that can measure magnesium levels, so we just assume that there is magnesium deficiency. Magnesium is found in dark leafy greens, pumpkin seeds, almonds, and its absorption can be compromised by calcium and iron supplements, so taking birth control pills and diuretics. High stress levels, diet high in sugar, also deplete magnesium. Next nutrient women with PCOS may be deficient at is zinc. Zinc supplementation in women with PCOS helps to improve insulin sensitivity. It improves egg quality, improves skin health, decreases facial hair growth, and reduces PMS symptoms. Zinc supplementation also regulates cholesterol balance. Zinc deficiency usually occurs as a result of poor diet. What I mean is high sugar intake and lack of animal protein can result in zinc deficiency. Zinc is found in meat, poultry, pumpkin seeds, beans, nuts, seafood, and whole grains. And a blood test can measure zinc levels to tell you whether you have sufficient zinc or you could be deficient. Taking too much zinc results in zinc overload. Vitamin B12 and folate. Women with, or patients, I should say patients with PCOS, because it affects both men and women, have elevated homocysteine levels. It contributes to increased cardiovascular risk. Normally, homocysteine is broken down into cysteine and methionine. This process requires adequate amounts of folic acid, vitamin B12, and vitamin B6. PCOS patients often take metformin, which inhibits the absorption of B12 and folate. Therefore, metformin may indirectly increase homocysteine and cardiovascular risk. One of the ways to avoid that is to measure B12 and folate levels and supplement if you're deficient. Food sources of B12 are animal products such as fish, meat, poultry, eggs, and dairy products. And folate is found in dark leafy greens, sunflower seeds, and liver. In the summer, when there is excessive exposure to UV sunlight, it's a good idea to supplement with folate because UV sunlight can break down folate in the skin. Selenium is another nutrient women with PCOS can be deficient in. It can be measured by a simple blood test, and selenium supplementation improves insulin resistance and normalizes cholesterol balance. We know that probiotic and selenium co-supplementation, so when they're administered together in women with PCOS, result in reduced testosterone, decreased facial hair growth, improved inflammation markers, and also positively affects depression and anxiety, which are commonly associated with Polycystic Ovarian Syndrome. Best source of selenium is Brazil nuts, and usually a couple of nuts a day is sufficient to keep sufficient selenium levels. Let's look at medications and how they affect nutrient levels in blood of PCOS women. Women with PCOS are often prescribed birth control pills to manage their symptoms, and it's important to know that birth control pills can cause folate, magnesium, zinc, vitamin B12, and vitamin A deficiency. Metformin, another common drug prescribed for polycystic ovarian syndrome, can cause vitamin B12, vitamin B1, and folate deficiency. Spironolactone, folate deficiency is very common. Additionally, many SSRI antidepressants can deplete folate. While we looked at common deficiencies that are associated with polycystic ovarian syndrome, when we correct those deficiencies, well, first we need to test. So you do your blood tests where it's applicable. If you're deficient, eat more foods that contain this nutrient, and if needed, supplement with a nutrient. And then retest your levels 3 to 6 months to see where you at and to see if you need further supplementation. Thank you for watching. Subscribe to my channel to receive more videos about infertility, polycystic ovarian syndrome, hyperbaric oxygen therapy, and women's health.